Hello, my name is Gisela Mala, and the topic of my tutorial is Disseminated Lyme disease. Definition: Lyme disease is a bacterial infection transmitted by the bite of one of several types of ticks. This stage can occur days, weeks, or even months after being bitten by an infected tick. Lyme disease and bacterial infection caused by tick with black foot.
Hi there, my name is Dr. Dominic Rowley and I'm the Medical Director of Let's Get Checked. I'm here today to talk to you about Lyme disease. So what is Lyme disease? Well, Lyme disease is an infection caused by a bacteria, and this bacteria is carried by ticks. These ticks are known as black-legged ticks or also deer ticks. They're most commonly found in heavy woodland areas or foresty areas. And the riskiest months for contracting Lyme disease would be between May and September. And this is when the ticks are at their youngest and are most likely to be biting. Lyme disease is a really interesting infection and one you may not have heard about. It is one of the fastest growing infections across Europe, only second to HIV and AIDS. In America, the incidence of Lyme disease has tripled in the past 30 years, and approximately 30,000 Americans are diagnosed with Lyme disease every year. What is somewhat worrying about Lyme disease is that the states that were classically very infectious for Lyme disease, for example, upstate New York, now every one of the 50 states in America is reporting an increase in Lyme disease. And there's also a 14% rise in Lyme disease in Europe. So you would imagine this is a very well-researched infection and disease, but actually it's not. It's one of the most unresearched infections in the Western world. So as I mentioned, Lyme disease is an infection caused by bacteria carried by a black-legged tick or a deer tick. So what's really important therefore to remember is that this is what we call in medical terms a vector-borne disease. So you cannot get Lyme disease from another person, and that's really important to remember. So patients often ask me, well, what are the early signs and symptoms of Lyme disease and what are the late signs and symptoms of Lyme disease? So as I mentioned, when most of us get bitten by a tick, we don't develop Lyme disease. We just clear the infection ourselves. But if the tick stays on the body for more than 36 hours, you have a higher chance of developing Lyme disease. Enter to it. So shortly after developing this rash, you may notice that you have flu-like symptoms. So you may feel shivery and shaky, you may have a mild fever, your joints may be sore, your muscles may be achy, and this is all part and common signs and symptoms of early Lyme disease. Late Lyme disease then, on the other hand, is much more specific and can cause more serious problems. It can affect your joints, leading to arthritis. It can affect your neurological system, and this can present in many different ways. It can present with a facial droop, i.e. facial palsy. It can cause meningitis. It can cause deafness, tingling in your extremities or the peripheries of your hands and feet, and numbness in any part of the body. And it can also affect the heart, and it can cause what we call a myopathy or an inflammation of the heart muscles, and this can lead to an irregular heartbeat. So these would be the much more serious sides, or late presenting symptoms of Lyme disease, which is important to say are not that common. So who should get tested for Lyme disease? Well, the majority of us will have been bitten by a tick at some point, so not all of us need to get tested for Lyme disease. However, if you are regularly camping or hiking in woodland areas, if you live in an area of rich vegetation or woodland area, if you've been bitten by a tick and then developed some of the symptoms that I've mentioned, like a flu-like illness, and in the days after being bitten by a tick, you are more likely to have developed Lyme disease, and therefore you should be tested. And if you regularly come into contact with large woodland animals, such as deer or horses, then it would be advisable to get tested for Lyme disease.
Antibiotic application in nursing. Antibiotics are the primary treatment for Lyme disease, and most all patients recover after antibiotic treatment. The recommended treatment for Lyme disease varies depending upon the stage of disease and the types of symptoms. The rate of recovery might also vary depending upon the specific symptom, and recovery might take weeks to months after finished antibiotics.
The prognosis after treatment of Lyme disease is generally very good. The vast majority of people receive their antibiotics, finish them, and return to their normal health. The prognosis is best when Lyme disease is diagnosed and treated early. The prognosis may be less good when the diagnosis and treatment is delayed. The prognosis after the second stage of Lyme disease, that early disseminated stage of infection, is also very good. The vast majority of patients recover with antibiotics and return to their normal state of health. There is, however, a subgroup of patients that has ongoing symptoms even after antibiotic therapy. This condition is called post-treatment Lyme disease syndrome. This post-treatment Lyme disease syndrome is a condition that's really characterized by a constellation of symptoms: fatigue, musculoskeletal pain, and cognitive complaints like difficulty with short-term memory or speed of thinking or multitasking. This constellation of symptoms is the characteristic by which we identify post-treatment Lyme disease syndrome.
The pros and cons. The pros: antibiotics prevent worsening of the disease and might decrease the duration and severity of symptoms. The musculoskeletal manifestation of Lyme disease. And cons. Here is no evidence that the Lyme bacteria are resistant to any of the antibiotics commonly used to treat the infection. In red requires additional therapy beyond the recommended dose might be used for brief period of time, typically 1 month. However, there is no evidence that additional treatment with any antibiotic result in improvement of a slowly resolving symptoms.
At different stages. Lyme disease occurs in 3 stages: early localized, early disseminated, and late disseminated. The symptoms you experience will depend on which stage the disease is in. Stage 1. Early localized disease. Rash. From 3 to 30 days after an infected tick bite, an expanding red area might appear that sometimes clears in the center, forming a bullseye pattern. The rash, erythema migrans, expands slowly over days and can spread to 12 inches across. It is typically not itchy nor painful. This rash, erythema migrans, will disappear after 4 weeks. Stage 2. Early disseminated Lyme disease. Early disseminated Lyme disease occurs several weeks after the tick bite. Bacteria are beginning to spread throughout the body. This stage is characterized by flu-like symptoms such as chills, fever, enlarged lymph nodes, sore throat, vision changes, fatigue, muscle aches, headaches. Stage 3. Late disseminated Lyme disease. Late disseminated Lyme disease occurs when the infection hasn't been treated in stages 1 and 2. Stage 3 can occur weeks, months, or years after the tick bite. This stage is characterized by severe headaches. Bouts of severe joint pain and swelling are especially likely to affect your knees, but the pain can shift to other joints. Heart problems such as an irregular heartbeat, brain disorders, encephalopathy involving memory, mood, and sleep. Short-term memory memory loss, difficulty concentrating, mental fogginess, problems following conversation, numbness in the arms, legs, hands or feet, eye inflammation, liver inflammation, severe fatigue, nausea and vomiting, neurological problems, weeks, months or even years after infection, you might develop meningitis, temporary paralysis of one side of your face, numbness or weakness in your limbs and impaired muscle movement. Contact your doctor immediately if you have any of these symptoms. Risk factors for Lyme disease include to spend time in wooden or grassy place. In the United States, deer ticks are most prevalent in Northeast and Midwest regions, which have heavily wooded areas where deer ticks thrive. Those in these regions are especially at risk. Adults with outdoor occupations also are at increased risk. Exposed skin. Ticks attach easily to bare flesh. Protect yourself and your children by wearing long sleeves and long pants. If you're in an area where ticks are common, don't expose your body in these places. Ticks attack an injectable compound prescribed by some alternative medicine practitioners to treat Lyme disease. Bismuthine, also called chromazine, contains high levels of the metal bismuth. Although bismuth is safely used in some oral medication for stomach ulcers, it's not approved for use in injectable form or as a treatment for Lyme disease. Bismuthine can cause bismuth poisoning, which may lead to heart and kidney failure. Thanks for watching. This is your
In su upload in Ecuador. In Ecuador, only one case of a 12 years old boy and has been reported. Studies have been carried out to diagnose its plasmodium vector and causal agents, but there are no results yet. About 10 to 15% of individuals with early Lyme disease symptoms realized by the dying bacteria cause a brief worsening of symptoms called Herxheimer reaction.
Welcome to Mayo Medical Laboratories Hot Topics. These presentations provide short discussion of current topics and may be helpful to you in your practice. Our speaker for this program is Dr. Ellie Thiel, Director of the Infectious Disease Serology Laboratory at Mayo Clinic in Rochester, Minnesota. Dr. Thiel will review the epidemiology of Lyme disease and discuss the strengths and weaknesses of available diagnostic testing with a focus on the two-tiered serologic testing algorithm as recommended by the Centers for Disease Control and Prevention. Dr. Thiel, thank you for presenting today.
Thank you for the introduction and to those of you joining us today. Before we begin, I should note that I have no relevant disclosures. And the utilization message for today is that as you view this presentation, consider the following important points regarding testing for Lyme disease. How is the testing going to be used in your practice? When should the tests be used? And how will results impact patient management? This presentation is the first in a two-part series on Lyme disease. The second presentation will be given by Dr. Bobby Pritt, who will provide information on the newest species of Borrelia associated with Lyme disease, named Borrelia mayonii, which was identified here at Mayo Clinic. The goals for today's presentation will be to describe the current epidemiology of Lyme disease and how this infection is transmitted. I will then briefly summarize the common symptoms associated with Lyme disease and spend some time discussing the recommended diagnostic methodologies with a focus on serologic testing and test utilization. Finally, I will conclude with some brief comments on treatment and prevention strategies. So starting with a brief historical perspective, Lyme disease as a clinical syndrome was first described by Dr. Alan Steer in a group of children in Lyme, Connecticut, who were originally presumed to have juvenile rheumatoid arthritis. It wasn't until the early 1980s that the etiologic agent and tick transmission vector for Lyme disease were identified by the entomologist Dr. Wilhelm Burgdorfer, after whom Borrelia burgdorferi was ultimately named. Borrelia species are mobile corkscrew-shaped spirochetes, as you can see in the top image, and members of this genus can be divided into those causing relapsing fever and those that cause Lyme disease, which will be the focus for today. The species associated with Lyme disease are all members of the Borrelia burgdorferi sensu lato complex, of which there are currently more than 15 species. Of these, 3 are associated with the majority of Lyme disease cases worldwide, as shown in the table below. In North America, until recently, Borrelia burgdorferi sensu stricto was the only causative agent of Lyme disease, and as mentioned earlier, Dr. Pritt will discuss the newest agent, Borrelia mayonii, in a subsequent hot.
In conclusion, the Lyme disease is a bacterial infection contracted from the bite of a disease carrying that can often be cured through a short course of antibiotics. Also, the symptoms are similar to those in the lupus and other autoimmune conditions. The diagnosis and treatment plan differ vastly.
Lyme disease is the topic for this video, and Lyme disease is something that happens to a lot of people who live in heavily wooded areas. I try to make these videos geographically independent, since people from all over the world are watching them, but this is one of those conditions that sort of is based in certain geographic regions. So let's talk about the type of tick that causes Lyme disease. Has a special name. It's called Exodus, whatever the pronunciation is. And there's different types, but this is the main name. And then what happens is this tick then transmits an organism into your body called a spirochete. And the name of the spirochete is Borrelia burgdorferi, and that's important to remember. So don't get confused. The tick's name is the Exodus tick, and the spirochete, which is the organism that the tick essentially introduces into your body, is called Borrelia burgdorferi. Then what happens is it involves the skin, because that's where the tick bite occurs. Eventually, this organism, the spirochete, the Borrelia, will enter into your lymphatic system, and later will disseminate into your bloodstream. And when that happens, that can cause systemic symptoms. So Lyme disease, essentially, if you have symptoms, there's 3 types of symptoms. They're localized, but they're also characterized by stage. So you have early localized, you have early disseminated, and then you have late. So early localized, which appears in 75% of patients, is really referring to that rash. And that rash has, at the site of the tick bite, has a special name. It's called erythema migrans. Erythema regions. Borrelia burgdorferi can be maintained in nature forever, pretty much, by this tick. So therefore, A, where it says Borrelia burgdorferi can be maintained in nature indefinitely by a tick vector, is the correct answer.